This is the fourth part of Lesson 5 about labor and birth complications. Now we're going to talk about cesarean birth. A cesarean birth is when the fetus is born through a transabdominal incision of the uterus. This is done in order to preserve the life or health of the mother or fetus. Most cesareans are performed when a condition exists that poses a threat to the mother and the fetus if a vaginal birth occurred, such as placenta previa or placental abruption. Common indications of cesarean birth can be found in your textbook. Elective cesarean, which may be referred to as cesarean on demand or cesarean on request, is a situation in which a cesarean birth is performed without a medical or obstetric indication. There are many reasons given for elective cesarean. Potential risks of cesarean on request include higher rates of endometritis, blood transfusions, and venous thrombosis, longer hospital stay and recovery time, increased risk of respiratory problems for the baby, greater complications in subsequent pregnancies. Cesarean on request should not be performed unless a gestational age of greater than 39 weeks has been accurately determined. The surgical techniques include both vertical and transverse techniques. The skin incision of a cesarean birth will be either vertical or transverse. The vertical skin incision will extend from below the umbilicus to the mons pubis. The transverse incision will be horizontal through the lower abdomen. The type of skin incision does not indicate the type of uterine incision. The two main types of uterine incisions include the low transverse and the vertical incision. In A here, you see the low transverse incision that goes horizontally through the lower segment of the uterus. In B, you see a vertical incision. There are two types of vertical incision: the low vertical incision, as you see in B, and the classic incision. Due to the high risk of uterine rupture with subsequent birth, vaginal birth after classical uterine incision is not recommended. Maternal-fetal conflict is a term used to refer to a woman's refusal to have a cesarean when indicated. The healthcare provider must try to discover why the woman is refusing the cesarean and overcome the issues associated with the refusal. If the provider is unable to do this, ethical and moral obligation may lead to the provider seeking a court order to force the woman to undergo a cesarean section. Complications and risks of cesarean birth include aspiration, hemorrhage, atelectasis, endometritis, abdominal wound dehiscence, or infections, UTI, injuries to the bladder or bowel, and complications related to anesthesia. The fetus may be born prematurely. Fetal injuries can occur, and the newborn is more likely to require resuscitation efforts and develop respiratory complications. There are economic risks because of the increased cost of the cesarean. The types of anesthesia used are spinal, epidural, and general. There are several factors that may determine the choice of anesthesia used. A planned cesarean birth may occur if labor and vaginal birth are contraindicated, or if birth is necessary but labor is not inducible, or the course has been chosen by the mother and her physician. A discussion about the possibility of a cesarean section should be included in childbirth preparation classes. The similarities and the differences in a cesarean and a vaginal birth should be discussed. The option of having the father or significant other present in the OR suite should be presented and made known. Safety alert. Immediately post-op, be aware that the mother may be sleepy and could fall asleep while holding the infant. Make sure that someone is there to monitor the mother until she is completely alert and oriented and able to move all extremities. Vaginal birth after cesarean, or VBAC. Indications that were originally present for a cesarean birth may not be present and are non-recurring, such as a frank breech, footling breech, or other breech presentation, or fetal distress. These patients may be candidates for a VBAC. The ACOG criteria for VBAC are found in your textbook. A woman who's had a prior cesarean may want to have a trial of labor in which she is given a chance for 4 to 6 hours of spontaneous active labor to assess the safety of vaginal birth for both the mother and the infant. This concludes our lessons regarding C-sections.